Imagine waking up one morning and suddenly struggling to walk. Your muscles stiffen, your legs twist, and every step feels impossible. Now imagine going to doctor after doctor, only to be told it's all in your head. This is the reality for many people with a rare and mysterious condition called Dopa-Responsive Dystonia or DARD. But why is it so hard to diagnose? And how does a simple pill completely change the lives of those who suffer from it? Stay with me because this is one of the strangest medical mysteries you've never heard of. DARD doesn't play by the rules. For most people, symptoms start in childhood, usually with difficulty walking. But here's where things get weird. As the day progresses, the symptoms get worse. A child who can walk in the morning might be completely unable to move by evening. Doctors often mistake it for cerebral palsy, multiple sclerosis, or even psychological conditions. One of the biggest challenges? It looks different in every patient. Some people have tremors, others have muscle stiffness or uncontrollable spasms, some even develop speech problems. And because DARD is so rare, most doctors have never seen a case in their entire career. Many patients go years, even decades, without answers. Imagine living with constant pain and mobility issues, only to be dismissed as faking it or misdiagnosed with a completely different neurological disorder. Some are even told they have Parkinson's disease, even though they're just kids. And here's the cruelest part. The treatment is ridiculously simple. A single medication can completely reverse the symptoms. But most people never get the chance to try it. It turns out DARD isn't caused by a problem with the muscles at all. It's a dopamine deficiency in the brain. That's right, just like Parkinson's disease, it's all about dopamine and the fix. A common drug called L-Dopa. For people with DARD, taking L-Dopa is like flipping a switch. A child who couldn't walk suddenly starts running. Someone confined to a wheelchair regains their mobility in days. It's so dramatic that doctors call it the awakening effect. But here's the crazy part. Because DARD is so often misdiagnosed, most people never even get the chance to try this life-changing treatment. So, if the cure is so simple, why do doctors struggle to diagnose it? There are three big reasons. One, it's incredibly rare. Most doctors never see a single case in their career. Two, the symptoms mimic other neurological conditions, leading to constant misdiagnoses. And three, many doctors simply don't know enough about it to consider testing for it. And here's something even crazier. A simple L-Dopa trial, just giving a patient the medication for a few days, could confirm the diagnosis almost instantly. But because it's so rare, most doctors don't even consider it. The tragedy of DARD isn't just how rare it is how many people are suffering without knowing the cure is right there. If you or someone you know has unexplained muscle stiffness, tremors, or mobility issues, especially if symptoms get worse throughout the day, ask a doctor about Dopa-Responsive Dystonia. A simple test could change a life forever. If you found this video interesting, make sure to like and subscribe for more medical mysteries and fascinating stories.